Jeff, I think what we need to do is what about if consumers still shop for pricing? Don't you think pricing would come down on certain things? And I get it. There are certain things that are just going to be expensive. So we do need to have some kind of backup coverage. But I think even, you said outside of a primary care visit, it's not affordable. I kind of disagree with that. MRIs, for instance, local hospital, $5,000. Shop around for an MRI, you can get one for $500. ACL surgery, local hospital, $50,000. Go down to the Surgery Center of Oklahoma, it's $6,000. So, and don't quote me on those prices, I'm not sure, but usually it's about 10-1 difference. So, I think if they're $5,000 for knee surgery. I mean, people pay $100,000 for a car. So why shouldn't consumers pay $5,000 for knee surgery? You go.
Well, I would say the reason that I disagree with that is the average American can't afford a $500 MRI or a $5,000 knee surgery, right? We take it for granted that people have disposable income in the United States right now. 90% of the country is living paycheck to paycheck. Whether it's a $500 MRI or a $5,000 knee surgery, they're lucky to have money to put gas in their car or groceries on the table. So I'm just pushing it from a different perspective.
Right.
You look the average American, right? I'm not talking about the people who have college degrees and are making $100,000 a year. Unfortunately, that class of American is getting smaller and smaller every year. And so the challenge becomes the people that $500 is a lot of money or $5,000 for knee surgery is a lot of money. They can't afford it. Whether it's $50, $500 or $5,000, it's too much for them. And that's part of the issue we're dealing with in today's market is a lot of us, like you and I on this phone call, we probably could scrape together $5,000 if we really had to have our knee repaired. But I know a lot of people that I graduated from college with or that I do business with that couldn't. And so that's part of the issue as well, right? It's like, even if I'm a consumer and I can get it for $5,000 down at Surgery Center of Oklahoma, which by the way, Keith does a great job. And I would send everybody there. But the people who have high deductible plans, Keith's not getting paid. Right. And so that's employers have raised deductibles and raised out of pocket and raised exposure to their employees at a pace that outdoes their compensation increases to where now, even if I got a good deal for an MRI, if my deductible is $500, I go in for the MRI company's not getting paid because Jeff, the patient, doesn't have $500 to pay it. I see it more, the average uncollectible debt from hospitals and physicians across the country is over 20% now. So over 20% of the time, the member doesn't pay them when they see them, which ultimately then means what? We got to raise rates to get that money back from other people. And so that was my point about the unaffordable side of it, even if I can shop for it, right?
I understand. I mean, I'm just playing devil's advocate and saying, you use the example of the TV. Well, that big screen TV people shop for, they spend more than $500 for it, and we know that lots of people like to buy a new car and have a $700 a month payment. So, I think really we need to promote. First of all, promote health and also promote consumers' priorities. And if we just keep telling them that the employer or the government is going to pay for their health care, then it's never going to be cheap. It's always going to be expensive. So, and they're never going to be able to afford it. So, and, I don't know the numbers. If those are true numbers, that 20% of healthcare bills are uncollectible. Are 20% of automobile loans uncollectible or 20% of hotel visits? I mean, these people come up with money somewhere. So, I don't think the answer is that they have to overcharge because they're not getting paid by somebody else. I mean, that's not fair to somebody like me that pays my bill.
Yeah. And you said a great word there, prioritize, right? How many of us in this country are overweight, eat too much, smoke too much, don't exercise enough, right? And then the comorbidities add up, and now healthcare is upon them. And to your point, they don't save their money to pay for their hospital bill or their physician bill because they've got other priorities. So you're right. I love that word. Americans in general need to prioritize their health, which ultimately leads to prioritizing paying for healthcare when they use it. It's lockstep with you. I see so many people that, I do open enrollment meetings all the time, and I'm talking to people about their benefits and how to use healthcare. And priority for healthcare is not in their top 10. It just isn't. No, you hear about I'm saving money for my college fund, or I'm saving money for my daughter's wedding, or I'm saving money for a vacation. How many times in your life have you heard someone say, I'm saving money for my healthcare expenditures for next year? Because, there's a chance I could have one, and I need to have $5,000 sitting there because that's how much my deductible is. You never hear that.